Hi, I'm Claudia St. I'm your HR partner and resource. We are your COVID partner and resource as well. And today we're talking about what to do with an employee that gets sick, when to bring them back. So, the first thing I recommend that you do is that you go to the CDC website and track all of the current symptoms of COVID, and they're changing. In addition to cough, shortness of breath, fever, and sore throat, we also now have malaise and intestinal distress and loss of taste and smell. Any employee who shows any of those symptoms should not come to work and should be sent home if they show them at work. Once home, they should not return to work unless, number one, they are fever-free for at least 72 hours without the use of fever reducers. 2, they are at least 7 days post-onset of their symptoms. And 3, have improved respiratory health. So they should not come back until all 3 of those things are satisfied. If they had a positive test and were confirmed to have coronavirus, they have to satisfy all of those three things in terms of the 72-hour fever with no fever and those other conditions 7 days since the onset of symptoms. But they also have to have 2 negative COVID tests that also are 24 hours apart from one another. So they need to have 2 consecutive negative COVID tests if they have previously tested positive before you return them to the office. What happens if you have an employee who is home with a loved one or a family member who is sick? You need to follow those same guidelines for when that loved one is no longer contagious. If that employee is home with a contagious family member, chances are they're going to contract that virus. Doctors we've been talking to for the cases that we've been dealing with are just assuming that family members are infected. So they're no longer infectious after 72 hours post-fever without fever reducer, 7 days after the onset of the illness, and improved respiratory health. That's when you start the clock on quarantining your employee. Once they can no longer catch the illness from their family member, then you want to start tracking their own health. Now, many first responders are following CDC guidelines to come back after 7 days of quarantine. That's really, I believe, because we are in short supply of those first responders and we need their services. From what I understand, the best resource out there is that your employees should be 7 days or 14 days post-quarantine. Now, what happens if an employee's family member is exposed but does not show symptoms and is not sick with COVID? That employee can probably come to work, but I recommend that they and everybody else in your workplace who is on site be wearing protective masks and gloves while they are working. That will give them peace of mind that they will stay healthy, and the likelihood that they will get infected by an employee or affect another employee will be greatly reduced if everybody is practicing the most strict social distancing, personal protective, and good hygiene practices. We hope this is helpful. We are available to help you with your COVID needs, and what we've learned is that when you have one infection, it does not resemble another one, and each one of these cases requires a lot of decisions in terms of having them leave, when they can come back, how to communicate with employees, how to disinfect your workplace, and everything else in between. We're here to help you with that. So go to our website, check out our COVID resource page. And in the meantime, I hope that you and all of your family members are COVID-free, that you are healthy, and that you have a safe and productive work week. Take care.